Welcome to Pharmaceutical and Medicinal Chemistry. Module 4 Central Nervous System Drugs. Chapter 4.2 Non-Selective CNS Stimulants. Learning Outcomes. At the end of this chapter, you will be able to comprehend the general functions and indications of CNS stimulant drugs. You will be able to classify them into analeptics, anxiolytics, antidepressants, and psychomimetic drugs. You will be able to summarize the properties, uses, and adverse effects of different categories of CNS stimulants. Contents: Introduction, indication of CNS stimulant drug, classification, analeptics, anxiolytics, antidepressants, and psychomimetics. What are CNS stimulants? CNS stimulants are the medicines that stimulate the brain by speeding up both mental and physical processes. They increase the alertness, confidence, blood pressure, heart rate, and respiration. They decrease the need for sleep, reduce appetite, and lessen inhibitions. Indications of the CNS stimulant drug. A doctor advises a CNS stimulant drug to a patient when he observes an attention deficit disorder, chronic lethargy, lack of energy, morbid obesity which is unresponsive to other treatments, narcolepsy is an insomnia problem, prolonged depression that is unresponsive to traditional antidepressants. Classification. CNS stimulants are classified into 4 types: analeptics, anxiolytics, antidepressants, and psychomimetics. Analeptics are the drugs which are being used to treat the patient suffering from depression, respiratory diseases, post-anesthetic respiratory problems, circulatory failure causing low blood pressure. The examples of analeptics are caffeine, amphetamine, ethambutol. Caffeine. The molecular formula is C8H10N4O2. The structure of caffeine and the chemical name is 137-trimethylpurine 2,6-dione. Properties of caffeine. It's a white crystalline powder, odorless, bitter in taste, and it is easily soluble in water. Advantages of caffeine. It's going to stimulate the cardiac muscles and coronary arteries. Adverse effects. Prolonged use of caffeine may produce confusion, insomnia, and excitement, ringing in the ears, headache, nausea, vomiting, and hyperacidity. The doses: caffeine citrate dose 120 to 160 mg. Amphetamine. The molecular formula is C9H13N. The structure of amphetamine and the chemical name is 1-phenylpropane-2-amine. Properties. It's a colorless volatile liquid. It has amine odor and the taste is slightly burning. It is sparingly soluble in water. Uses. It causes increased wakefulness and it's going to improve the cognitive control and induce euphoria and excitement and happiness. It's going to increase the muscle strength and reduce fatigue. Adverse effects. It causes a thickening or hardening of the artery walls and it causes moderate to severe hypertension. It has a tendency to become agitated and it causes depression, hypothyroidism, and it leads to thinking about or attempting suicide. Ethambutol. The structure of ethambutol. The molecular formula is C12H17NO3. The chemical name is NN-diethyl-4-hydroxy-3-methoxybenzamide. Properties. It's a colorless crystalline solid. It is bitter in taste. It is odorless and sparingly soluble in water. Uses. It is used for the treatment of chronic pulmonary disease. Adverse effects. It causes sneezing, coughing, muscle twitching, and convulsions. Anxiolytics. Anxiolytics are the mood stabilizers which act on the brain and reduce the anxiety symptoms. Examples of anxiolytics are Librium, Valium, Prazepam. Librium chlorodiazepoxide. The molecular formula is C16H14Cl N3O. The chemical name is 7-chloro-2-methyl-amino-5-phenyl-3H1,4-benzodiazepine 4-oxide. The structure of Librium. Properties. It's an yellow crystalline powder which has no odor and it is freely soluble in water. Uses. It's been used to treat insomnia, anxiety disorder, panic disorder, post-traumatic stress disorder. Adverse effects. The adverse effects of this drug are it causes drowsiness, dizziness, tiredness, weakness, dry mouth, diarrhea, upset stomach and change in the appetite. Dosage. Librium tablet 5 to 10 mg. Valium. Valium is the diazepam. The molecular formula is C16H13Cl N2O. The chemical name is 7-chloro-1,3-dihydro-1-methyl-5-phenyl-2H1,4-benzodiazepine 2-one. The structure of diazepam. Properties. It's a light yellow crystalline solid. It has no odor, bitter in taste and insoluble in water. Uses. It is used to treat anxiety, seizures, muscle spasm or twitches. Adverse effects of diazepam. It's going to cause allergic reactions such as skin rash, itching, hives, swelling of the face, lips, tongue or throat. It causes CNS depression, slow or shallow breathing, shortness of breath, feeling faint, dizziness, confusion, trouble staying awake. It also creates a thought of suicide or self-harm, worsening mood, feeling of depression, etc. Dosage. Diazepam is being given in the dose of 2 to 10 mg. Prazepam Wellstran. Molecular formula is C19H17Cl N2O. The chemical name is 7-chloro-1-cyclopropyl-methyl-1,3-dihydro-5-phenyl-2H1,4-benzodiazepine 2-one. Properties of diazepam. It's a colorless to pale yellow solid. It has bitter in taste and it has no odor. It is slightly soluble in water. Uses. It is being used for the anxiety disorders, insomnia, that is sleeplessness and seizure disorders. Adverse effects. It causes drowsiness, confusion, problems with walking and coordination, lack of concentration and memory problems, dizziness, weakness, slurred speech, using higher doses than prescribed. Dosage of Prazepam is 10 mg. Antidepressants. They have been used for major depressive disorder and anxiety disorders, chronic pain and addiction to drug. The examples of antidepressants are opipramol, iproniazid and phenelzine. Opipramol. The molecular formula is C23H29N3O. The chemical name is 2,4,3-benzo-B1-benzazepine 11-yl-propyl piperazine 1-yl-ethanol dihydrochloride. The structure of opipramol. Properties. It is a colorless to pale yellow color solid. It has no odor. It is bitter in taste and it is sparingly soluble in water. Uses. It's been used to treat depression. Schizophrenia is a serious mental disorder, anxiety disorders, psychosomatic disorders. Adverse effects. It causes dry mouth, a stuffy nose, constipation, drowsiness, dizziness, increased sweating, blurred vision, speech impairment, tremor and liver dysfunction. Dosage. Opipramol is being given to the patient in the range of 50 to 300 mg. Iproniazid. The molecular formula is C9H13N3O. The chemical name is N-propane 2-aryl pyridine 4-carbohydrazide. Properties of iproniazid. It's a colorless crystalline solid. It has no odor and it is bitter in taste and soluble in water. Uses. It's been used to treat depression. Adverse effects. It causes jaundice, nausea, abdominal pain, fever and skin rash. Dosage. Iproniazid is being given to the patients in the range of 10 to 15 mg. Phenelzyme. The molecular formula is C8H12N2. The chemical name is 2-phenyl ethyl hydrazine. The structure of phenelzyme. Properties. It's a colorless solid which has no odor. It is slightly bitter in taste and sparingly soluble in water. It is used to treat depression. Adverse effects. It causes chills, cold sweat, dizziness, shaking in the legs, arms, hands or feet, sudden jerky movements of the body and swelling. Dosage. Phenelzyme is being given to the patients in the dose of 15 mg. Psychomimetics. Psychomimetic drugs can produce altered states of consciousness, which are being characterized by major alterations in the thought, mood, perception, as well as other changes. Psychomimetics. The examples are clozapine and quetiapine. Clozapine. The molecular formula is C18H19Cl N4. The chemical name, it is 3-chloro-6,4-methyl-piperazine 1-aryl-11H-benzo B1,4-benzodiazepine. The structure of clozapine. Properties. It's a colorless pale yellow crystal. It is bitter in taste. It has no odor and it is insoluble in water. Uses of clozapine. It is used to treat severely ill patients with schizophrenia. Here are the symptoms of schizophrenia, and it is being used to lower the risk of suicidal behavior in patients with schizophrenia and schizoaffective disorder. Adverse effects. It causes hypersalivation, tachycardia, rapid beating of the heart which may be regular or irregular, hypotension, sedation, delirium is a confusion, and then coma, respiratory depression or failure. Dosage. The clozapine dosage is 12.5 mg. Quetiapine. Molecular formula is C21H25N3O2S. The chemical name is 2,2,4-dibenzo BF1,4-thiazepine 11-aryl-1-piperazine ethoxyethanol. Properties. It's a colorless solid which has no odor. It is insoluble in water and it tastes bitter. Uses. It's been used for schizophrenia, acute manic episodes and adjunctive treatment for major depressive disorder. Adverse effects. Feeling sleepy during the day, headache, feeling dizzy, putting on weight or changes to the appetite, constipation, swollen breasts, irregular periods and fast heartbeat are the adverse effects of this drug. Dosage. Quetiapine 25 mg. So what all we have learned from the CNS stimulants? In a nutshell, we have learned the classification and action of different classes of CNS stimulant drugs along with the usage, adverse effects and dosage forms of analeptics, anxiolytics, antidepressants and psychomimetic drugs. Thank you.